But the last thing you want to have to think about is this going to put me in debt? Is this going to break the bank? Will I actually be able to afford the bills that the hospital stay generates? In fact, one study found that in the first year of a baby's life, parents can expect to spend a third of their income on everything from diapers and clothing to nursery fees and childcare. Labor and delivery costs can add even greater financial burdens on families trying to have a child. It's no wonder then that new mothers are twice as likely to have medical debt compared to young women, with 11% of new mothers reporting debt of over $1,000. Good morning, everybody. Thank you for joining. Today, I want to talk about the extraordinary cost of giving birth. The United States is one of the most expensive countries in the world to have a baby. In New York, a traditional birth can cost upwards of $8,000, while a C-section can cost over $12,000. Insurance companies may pick up part of the tab, but even when you have good insurance, you can expect to pay an average of almost $3,000 out of pocket on labor and delivery and other associated fees. If you have a high deductible insurance plan, pregnancy complications, or gaps in your coverage, you could end up owing even more out of pocket in medical costs. But when you're having a baby, the last thing you should be worried about is how to pay your hospital bills. As a mom, I can tell you there are so many more important things that you think about when you're having a child. You need to think about giving birth. You need to think about what you're going to do at work. You need to think about, do you have the things a baby needs, like a crib, and do you have the right car seat? Do you have the right diapers? I mean, these are all things that young parents are constantly thinking about. But the last thing you want to have to think about is this going to put me in debt? Is this going to break the bank? Will I actually be able to afford the bills that the hospital stay generates? In fact, one study found that in the first year of a baby's life, parents can expect to spend a third of their income on everything from diapers and clothing to nursery fees and childcare. Labor and delivery costs can add even greater financial burdens on families trying to have a child. It's no wonder then that new mothers are twice as likely to have medical debt compared to young women, with 11% of new mothers reporting debt of over $1,000. Such debt or potential to incur can discourage mothers from going to the doctor as often as they should, either while pregnant or after giving birth. Sometimes mothers wait to seek out care until it's too late, putting their health and sometimes the health of their baby at risk. In turn, this influences the rate of maternal mortality, which has claimed the lives of far too many moms across our state. Maternal mortality is largely preventable with access to affordable, high-quality health, prenatal, and postpartum care. Reducing the cost of childbirth can help to save the lives of some of the 22 women who die for every 100,000 births in New York State. The high cost of childbirth places an undue burden on our nation's healthcare system and our larger economy as families are forced to choose between paying off their debt and paying off other essentials. Unpaid medical debt can also put a strain on healthcare providers and hospitals, especially in those rural communities struggling to recoup costs. Thankfully, for moms and eligible families on Medicaid, childbirth can be free. But for families with private insurance, the amount they still have to pay, it can be enormous. It's why I'm proud to introduce Supporting Healthy Moms and Babies Act, a bipartisan bill that would make childbirth free for families with private insurance. It would do so by categorizing all expenses associated with prenatal, childbirth, and postpartum services as essential health benefits and requiring insurance companies to fully cover those costs so that families don't have to pay. This includes ultrasound, fetal monitoring, labor and delivery, and postpartum care, including physical and mental health support for a year after giving birth. Giving birth is one of the most intrinsic processes of human life. It's also supposed to be one of the most joyous moments for any family. Requiring that insurance fully cover childbirth will provide families with a financial predictability and stability and put them in a better place to care for their kids. I look forward to working with my colleagues in Congress to move this important legislation forward, and I'm happy to take questions.
Brian O'Neill, WLEA.
Go ahead, Brian.
The One Big Better bill, does that affect your legislation at all, or the way you come up with your legislation? Are you thinking of the Big Better bill in the back of your head?
No, because the Big Better bill is so destructive to some things that will really impact pregnant moms and families. cutting 8.6 million in cuts from Medicaid and the ACA. It's 5.1 million from sabotage and cuts to enhanced tax credits. I'm not sure what that is. Oh, ACA subsidies. So that takes away from the ACA. The bill would require Medicaid recipients to work or volunteer, clamping down on states' use of special arrangements known as provider taxes to pay their share of Medicaid costs. So basically, it's just going to take a hatchet to Medicaid and all the people who receive their health care through it.
If I can ask a slightly off-topic question.
Yep.
What do you say to the argument that a lot of conservative commentators and Republican politicians make that Medicaid is only being cut off from fraudsters who are getting Medicaid money from dead relative payments or undocumented immigrants?
It's not true. It's a false statement. And I would ask them, show us exactly which fraudsters and which undocumented immigrants are receiving Medicaid and ACA. So 14 million Americans are going to lose their access to health care. And it'll impose about $1 trillion of healthcare cuts. And those are facts. So there aren't 14 million fraudsters and 14 million undocumented individuals on Medicaid.
Thank you.
Good afternoon, Senator. This is Rachel Knapp with WENY News DC Bureau. I am wondering, how will this legislation impact, or I guess, does it have, what does it do for after childbirth, for example, any follow-ups, or is it just kind of in the childbirth process? Thank you.
It includes up to 1 year of postpartum care for conditions caused or exacerbated by pregnancy, like diabetes, hypertension, obesity, as well as mental health and substance use disorders.
Thank you.
It also includes behavioral health services related to new parenthood for adoptive parents, and it also has care for miscarriages and spontaneous pregnancy loss.
Thank you.
And the great thing about this bill is it's already bipartisan. It's me, Senators Hawley, and Senators Highsmith, and Tim Kaine. So we have 2 Dems and 2 Republicans, which is great. And it's also bipartisan in the House. Okay, anyone else have a question?
I did have one other, Brian O'Neill, WLEA, if you don't mind.
Go ahead.
You're big on the lithium ion battery for e-bikes issue. Here in the smaller towns around here, the police chief and the ambulance crews are complaining about e-bike riders and e-scooters speeding around and getting into accidents, not wearing helmets. I was wondering, are you aware of any legislation at the national level on this kind of thing?
Not yet. Our national legislation was about banning the bad batteries from China because they're the ones that were causing so much fires. So that legislation is essential because it will make it less likely that delivery drivers and enthusiasts buy these extra large batteries made in China that have been literally starting fires in apartment buildings throughout New York City.
Thank you.
And that bill didn't pass yet, did it?
No,
Yeah.
they did it by rulemaking, but we just found out that they have since now gone back on.
Yeah, so what happened on that bill is we got through rulemaking under the Biden administration, the law put in there, and then this administration's already rolling that back. So we still have to pass it to make it a law. Right? Because we didn't pass it.
You didn't pass it.
Yeah.
They did it under Trump administration.
Oh, it was under Trump? Yeah, okay, so let me give you the specifics. So what actually happened was it was under the Trump administration that they issued the rulemaking, but it was issued by Democratic appointees who were already in place from the Biden administration. So Trump has now fired those people that issued the rulemaking. And so we think the new people that come in are going to unwind it. So we still have to pass the law. But yeah, it stresses me out when I see people not having helmets, especially kids. It's frightening. Absolutely frightening. We should, we really should have? We should have a PSA program about how many kids and how many people die because they fall off the e-bikes and e-scooters without helmets, because I'm sure it's a huge number. Okay, thanks everybody.